I'm Dr. Leena in Meshram from Mahatma Phule AC College, Panvel. Today, we'll talk about few basic concepts of immunity. Immunity. Immunity is defined as resistance against any kind of infection. That is, your body's mechanism to defend itself from any kind of infectious agents or any kind of pathogens. When we talk about immunity, we also should know about the different components of immunity and types of immunity. Today, we'll focus upon two different types of immunity, that is innate immunity and acquired immunity. Innate immunity is said to be innate since this immunity is there in your body right from the birth, and hence it is also called as inborn immunity or non-specific immunity. Inborn or non-specific immunity. The second kind of immunity is acquired immunity, which is a specific immunity. Now, as I told you, innate immunity is right from the birth. That is, when you are born, this immunity is right there in the child. The components of innate immunity are physical barriers, physiological barriers, and few cellular cells which are already there in the child when the child is born. And when you talk about acquired immunity, is nothing but the individual acquires this kind of immunity right after the birth when the child is exposed to a certain kind of infections. We will today talk about in detail types of acquired immunity. Types of acquired immunity. Types of acquired immunity. As I told you, acquired immunity is developed when the individual is directly exposed to some kind of infectious agents or pathogens such as bacteria or viruses. When you talk about different types of acquired immunity, it will be coming under active immunity and passive immunity. Active immunity and passive immunity. Active immunity is when an individual, when it is exposed to any kind of infection, the individual will develop antibody against that particular antigen. When an individual is exposed to any kind of antigen, the individual will develop antibodies. The individual will develop antibodies against that particular infection in a very natural way. How? I'll give you an example of chickenpox. Chickenpox, everybody knows about chickenpox, that when you are exposed to the virus of chickenpox, you will develop certain symptoms, certain boils, and then slowly you will heal of that particular disease or that particular infection. So once you are naturally exposed to this kind of virus, your body develops an antibody against it, and then slowly you get better and you get well. Whereas when the individual is not able to develop the antibodies, then you have to give antibodies to that kind of patients, and then it is called as passive immunity. That is called as passive immunity when antibodies are given. Secondly, active immunity, we will divide it into two types. That is natural and artificial. natural immunity and artificial. Here also we will divide passive immunity into natural and artificial. Okay, so when you talk about naturally acquired active immunity, when you talk about naturally acquired active immunity, we can give you an example about chickenpox or any kind of infection. When a person is naturally exposed to that kind of infection and a person develops antibody against that kind of infection, then we say that this kind of immunity is nothing but natural but active immunity. Secondly, when you come to artificial active immunity, now in this case, the person is given a vaccine. A person is artificially induced to that kind of antigen. Example is what? Vaccine. Now you must have heard about polio. You must have heard about BCG vaccines. What a vaccine? Vaccines are nothing but the virulent, which is half killed, which is less activated, or we can say inactivated, heat killed, but it is a pathogen that has to be introduced into the body, and in response to this kind of vaccines, the individual develops antibody against the infection. So artificially induced vaccines are nothing but an example of actively acquired immunity. Again, active immunity can be classified into natural as well as artificial. Natural, we say natural when the individual is exposed naturally to an antigen, and artificially acquired immunity, that is when we expose the individual with a kind of antigen, but that is introduced into the body with the help of vaccines. Now we come to passive acquired immunity. In case of passive acquired immunity, again passively. The immunity is developed passively, and this again is divided into natural as well as artificial passive immunity. Natural passive immunity, that is when the individual will get immunoglobulins directly from the mother to the child. Passively, the antibodies, directly the antibodies passively will go from the mother to the child. For example, immunoglobulin G, IgG or IgA. Okay, now this immunoglobulin, that is IgG or IgG, are passively passed from the mother to the child through the placenta, and it will give this IgG is the first immunoglobulin which passes through the placenta, and it gives the child protection against initial infections when the child is exposed in the environment. So IgG is a kind of antibodies that is passively passed from the mother to the child. When we come to artificially acquired passive immunity, I told you in this case the antibodies are given, or we can say antibodies are induced into the body, or they are given to the body, given to the patient when the patient is suffering from any kind of diseases. Here the patient lacks the capacity to develop antibodies. The patient cannot develop antibodies. The patient is immunologically suppressive. We can say the patient has not, there are some kind of errors in the body where the patient is not able to produce enough amount of antibodies. So in this case, antibodies are given to the patient, or the antibodies are introduced into the body of the patient, that is through the donation of plasma or any other kind of donation. So this directly, like for example, monoclonal antibodies are also given in this case. In the case of snake bite also, the antibodies are given to the
patient. So this is coming under artificially induced immunity, but this is again passive. It is again passive. So what we have seen is acquired immunity. There are two types. One is active immunity, the other one is passive immunity. In active immunity we have natural and artificial immunity. In passive immunity we have natural and artificial again. When you talk about natural, it is like example is chickenpox. When you talk about active, then the example is vaccination. And when you talk about passive immunity, where we are actually giving nothing but the antibodies, so you can say passive, we are talking about antibodies. And when you talk about active, then it is nothing but antigen. It is nothing but antigen. So I hope you understood different types of immunity and the natural and passive immunity. Thank you.